Welcome everyone to my Goa Network. Today is World Liver Day. We are here at the Manipal Hospitals with Dr. Sriram, with whom we will talk about the how to keep our liver healthy and know more about the ailments that concern our liver. Welcome, doctor. There is a misconception that only alcoholics get liver diseases. How true it is, and what are the ailments that people suffer regarding the liver?
So basically there are two types, like broadly we can distinguish into alcoholic liver disease and non-alcoholic fatty liver disease. So non-alcoholic fatty liver disease, there could be an n number of causes. It could be due to like junk food, obesity, or underlying diabetes mellitus, or some family issues. So these are some of the things which are most common causes of non-alcoholic fatty liver disease.
These fatty liver disease, basically what kind of signs and symptoms that we can see and try to notice this disease earlier?
So it could be most of the 60% of the patients doesn't have any symptoms. Some patients might experience a mild right upper quadrant pain, and there are some stages like initially the fatty liver disease will progress into fibrosis and later into chronic liver disease, that is nothing but cirrhosis. So initially patient can have a mild right upper quadrant pain, and during fibrosis and liver cirrhosis patient can experience like abdominal swelling in the form of ascites or else like blood vomit.
But what could be the causes of this kind of liver disease, especially the non-alcoholic base?
So as initially I mentioned, it could be because of this type 2 diabetes mellitus and excess obesity, and during this lifetime life changes like having a carbonated drinks, a lot of junk food and late night foods. These are the some of the things which can cause fatty liver disease. Basically we have to curb this carbohydrates and non-essential fatty acids, and apart from it these carbonated drinks totally should be avoided, and alcohol should be avoided, and smoking too. And this late night food, I always advise my patients to have an early dinner like around 7 to 8 p.m. and bedtime and dinner time should be at least 3 hours apart.
But these kind of diseases, are they curable? To what degree?
Yeah, definitely. If the patient is in like initial stages like only fatty liver disease, then we can advise some lifestyle modifications like at least 30 minutes intense exercise should be done, like brisk walking, or else patient should sweat at least 30 minutes a day, at least 5 days per a week, and should avoid this carbonated drinks and junk food and rest all things. So basically patient should have a lot of fiber diet, which includes a lot of fruits and green leafy vegetables.
What other kind of diseases can affect our liver?
Yeah, apart from this fatty liver disease, it's like a systemic disease. This fatty liver disease can affect, can cause polycystic ovarian disease, and like stroke and other coronary artery disease, also CAD.
So, but it is said that liver is like a self-regenerating organ.
Correct.
So, how much of this effect, how much damage can liver take due to this fatty liver disease without being detected?
So if it is like initial stages, it can regenerate very quickly, but during the progress of the disease, if continuously we are inserting that injury to the liver, then some cells might die and it will form scar and finally turn up into fibrosis and later into cirrhosis. So if initial stages only, we can halt the prognosis by doing some investigations such as a fibroscan, so that we can stage the liver and we can suggest some medications to the patient apart from lifestyle changes. So in India, the main cause of chronic liver disease is the first place is fatty liver disease, and the second and third is hepatitis B and hepatitis C. So hepatitis B and hepatitis C is generally transmitted through needles, and like vertical transmission is there and horizontal transmission is there, like using syringes and during childbirth. So hepatitis B is basically prevented through vaccination. So 3 shots of vaccination would be sufficient to prevent this hepatitis B.
I remember getting a shot during my SSC days. Are they curable hepatitis diseases, or they can be a chronic health condition which can
So hepatitis B can turn up to chronic liver disease, but a lot of medications are available. But still, the patient should be on a long time medications.
So there is a myth that there is a certain safe level of alcohol that I can drink without damaging my liver. Does this myth hold any ground?
So initially there are studies like up to a particular limit it is safe, so people can drink alcohol. But right now recent studies showed any amount of alcohol will cause injuries to liver. So I doesn't recommend any of my patient this amount of alcohol is good for your liver or good for your health. So I always ask my patients to stop drinking alcohol.
So it's kind of
Yeah.
it's totally a myth that there is
Correct,
some
correct,
certain
correct.
safe level. In recent numbers, there have been increase in liver-related diseases. So what should one do and what should be done to prevent these kind of messages? What would be your message to our viewers, to youngsters, to keep a healthy liver?
So definitely one thing is these food habits. As I mentioned earlier, better to avoid this junk food and everything. If you are having any kind of symptoms like upper abdominal pain or like swelling in your abdomen, just come to the doctor. He will investigate and he will diagnose it what is going on with your liver or anything else in your abdomen.
So thank you, doctor, for this valuable information. Hope all of you, our viewers, will find this useful and try to inculcate the changes that doctor has suggested in our lifestyles to keep our liver healthy, to keep ourselves healthy. For more such things, keep watching My Goa Network. Thank you.